On ear infections and eustachian tube disorder, there's an awful lot of kids that come in to see me because the eustachian tubes aren't working good. And basically what happens when the eustachian tubes don't work good is the pressure doesn't equalize between the ear and the back of the throat. When that eustachian tube doesn't open normally, there's a tendency for the oxygen that's in the middle ear to become absorbed. When the oxygen gets absorbed, it creates a negative pressure or a vacuum. That vacuum works, for lack of a better way of explaining it, kind of like a hickey. When you suck on the skin of the ear so hard, it literally sucks fluid into the ear. Now that fluid has sugar and protein in it, and that sugar and protein is bacteria food. And so if you've got bacteria that live in your adenoids in the back of your throat, a short distance away, down the eustachian tube, those bacteria find their way in there. They eat the sugar and the protein and cause you to have an ear infection. And so really the reason why a lot of kids have ear infection is aggravated by the fact that the eustachian tubes don't work good. And there are two times in our lives when our eustachian tubes don't work good. One is when we're little kids, and a second one is as we get older that those eustachian tubes start to not function quite as well, usually, farther in life. But for little kids anyway, when kids get more than 5 to 6 ear infections per year, or they keep fluid in their ears for longer than a couple of months, especially in kids that are showing any signs of language delay, those kids we usually recommend putting tubes in the ears. So again, the reason we put tubes in the ears are more than 5 to 6 infections in a year in a child that keeps fluid in the ear for more than a couple months, and we'll push it a little bit more if the child's got speech delay. So if you've got a child that's really not talking good, they've had fluid in their ears for 2 months, I'm probably going to tell them, let's get the tubes in. What the tubes do, the tubes don't really fix the problem. The tubes bypass that eustachian tube. That eustachian tube is supposed to open when they yawn, swallow, basically. It happens for most of us all the time. Our ears swallow and our ears pop. Some people that doesn't happen, and those are the people that wind up getting the ear infections and the ear problems. So what the tubes do is it's like a detour. I tell my patients that if the expressway gets blocked up, they put a roadblock in the middle of it. What happens with all the cars? Well, they're going to go around the side. They're going to find a way to get to where they're going. They just have to go around, and that's kind of what the ear tube does. Is it creates a detour around the broken eustachian tube. But now when that tube falls out, if the eustachian tube hasn't started functioning normally yet, they can continue to have the problem where about 20% of kids will go on and need a second set of tubes. The ear tubes it's a great procedure. It literally is like piercing your ear. I could probably put tubes in your ears faster than a lady at the mall could could pierce your ear. So it's a very brief procedure. And in adults, we can do it in the office. And little kids, unfortunately, though, they won't sit still to let me do it in the office. And so that's why they need a brief anesthesia to be able to do it. The biggest risk of tubes are really a 2% chance that when the tubes fall out that the hole could stay there. For a brief period in a child's life, we want the hole to be there, but as they get older, around 5, 6, 7, we want that hole to close. If it for some reason wouldn't close, it would require a second brief procedure, about a 10 or 15 minute procedure, where we take some skin from behind the ear and we patch the hole in the eardrum, much like you patch a bicycle tire if you get a hole in the bicycle tire. So that's kind of how eustachian tube dysfunction works. That's sort of the patient population, why we do it, and kind of a little bit on the common drawbacks to the procedure.